Virtually everyone nowadays, it seems, is familiar with the gut microbiome, the importance of having a nice, healthy balance of good microbes, balanced out with neutral and maybe a few not so good microbes living in the gut. But not a lot of discussion is out there about the sinus microbiome. And in my practice, I think a lot about patient sinuses because I work with many patients who are dealing with mold illness, and in some of those cases, in many of those cases, they have some colonization of mold in their sinuses. I've also worked with a lot of patients with chronic sinus issues that are unrelated to mold, maybe due to a fungal or a yeast overgrowth, or maybe a bacterial overgrowth. And what I found is that some patients, we treat the infection or the recurring infections, thoroughly with the right types of herbal extracts or what have you. I like frankincense essential oil nasal spray is one of my go-tos. Sometimes we'll use nebulizers if needed. But then, and in many cases, we just treat the infection thoroughly, and then it doesn't come back and things are good to go. But some patients will have a recurrence of symptoms, and despite adequate treatment, and in those cases, it can be very important to work with a nasal probiotic to help establish a healthy microflora in the sinuses. So, am I referring to taking an oral probiotic and hoping that somehow helps the sinus microbiome? Nope, I am referring to basically using probiotic nasal drops and reestablishing the microflora by putting the microbes right up the schnoz. The method that I've used up to this point has been using a product called Megaspore Biotic primarily, and that's diluted in a certain amount of saline, and then just basically put that up the nose, and it can work really well. Where I can't provide any medical advice on social media, you have to talk to your healthcare provider about a protocol for that if that's something that might be applicable for you. But it's been very helpful in terms of reestablishing a healthy microflora or microbiome in the sinuses. The other scenario in which I would use the nasal Megaspore Biotic or other spore form probiotics could work as well, I'm sure, would be folks who just can't tolerate a stronger treatment. So they can't tolerate even the starting concentration of frankincense nasal spray or nebulized thyme oil or hydrogen peroxide or whatever it is that we're using. And so we might start with, in those cases, we'll work with the nasal Megaspore Biotic, and because it does seem to have some antimicrobial effect as well. And so either that'll do the job for those more sensitive patients, or they're tolerating the Megaspore, they're getting some symptom improvement, and then maybe we'll try the stronger treatments like the frankincense or whatnot moving forward. And in many cases, they'll be able to tolerate it. Sometimes we still have to build it up pretty slowly, but it's something that the probiotic kind of primes the pump, so to speak, so that the stronger treatment can be better tolerated in a significant number of patients. Not everybody. Some folks, it's just really hard to get an effective nasal protocol in place, but that's definitely the extreme minority of patients in my experience. So microbiomes, not just for intestines, for sinuses too. There's a skin microbiome, vaginal microbiome. There's microbiomes all over the place. There's a bladder microbiome, as it turns out. For many years, it was thought that the bladder is sterile. It turns out that it's not. So there are microbes all over the place, in and on us, and hopefully we can play nicely with them so they treat us well and we don't have symptoms related to their imbalances. So I hope that this information was of interest. If you have any questions or comments about this topic or anything else, please post in the comment section below, and I will leave it there for now.